This is your special interview here on Morning Wave in Busan. The World Health Organization, or WHO, has declared an Ebola outbreak in this sub-Saharan African nation, the Democratic Republic of Congo, or DRC. And so the declaration will allow for more health workers and resources to flow into the affected area in the hopes of containing this disease. So let's find out more about Ebola and this particular outbreak with Professor Ramon Shaban, professor and clinical chair of infection prevention and control at the University of Sydney and Western Sydney Local Health District. Hi, thanks for joining us today.
Good morning.
Yes, so it seems that the WHO has declared an Ebola outbreak in the Democratic Republic of Congo, that this is a global health emergency. First of all, Professor, what exactly is deemed a global health emergency? How serious does it have to be?
Yes, so the World Health Organization has declared this particular event a public health emergency of international concern. That is a definition that's prescribed under the international health regulations. And basically what that means is that when there is a threat to more than one member state of the World Health Organization, and that threat presents a public health risk and it requires an international response, then the WHO declares it one of these kinds of events. And so, as you've just outlined, this declaration means that the member states have a legal duty to respond to the event, and it makes available a range of support, resources and funding to meet with the needs of the response and the outbreak.
I see. So not only is it an announcement saying basically, please be aware, be careful, but it's also to get the proper funding and I guess the help that these areas need, right?
Yes, that is correct. So the outbreak in this particular outbreak is not new. It's been ongoing for quite some time.
Yes.
But the fact that it's spread to other provinces now within the DRC, certainly within Uganda and Goma, and now Kivu, raises the concern. And so when events like this occur, then the WHO Emergency Committee assesses the facts, and they've determined to declare this what's referred to as a public health emergency of international concern.
Right. So a lot of the news articles that I've seen mention the eastern city of Goma, the country's largest city in the eastern province of the DRC. So how serious is this? How significant is this that there are Ebola cases in Goma?
Well, these are significant events, and so these particular cases that have emerged in recent weeks have occurred in areas where Ebola is not ordinarily found. Ebola virus disease is an endemic disease, which means it exists in many of these areas year in, year out, but that the emergence of particular cases in areas where they haven't found Ebola previously, and the frequency by which that has occurred, in other words, within some weeks, has raised the concern about the possible spread, the further spread of this disease to other parts of Africa and beyond, more broadly. And so the declaration is an attempt to marshal resources to further contain the spread of this particular disease.
Yes, and so from what I understand, the name of the virus comes from the Ebola River in the Congo. But if you can further explain what exactly is Ebola, because for us here in Korea, we don't know what it is, what the symptoms are, and how you can get it.
Yes. Happy to. So Ebola is certainly named after the Ebola River in the Congo. It's classified as what we call a viral hemorrhagic disease. It's a virus that causes multiple problems with the body's systems, and so it's a disease that isn't ordinarily found in humans. It's an animal-based disease, so we think it lives in bat populations in forest and other areas. It doesn't make the bats unwell, but they just carry the virus. And that virus flows over to humans accidentally. And so it's how we interact with the environment that causes us to become infected. Now, Ebola is one of a range of viral hemorrhagic fevers. There are others called Lassa fever and Marburg. And these are all spread principally by contact. And so if somebody comes in contact with somebody who is infected and they come in contact with their blood or bodily fluids, then they are at great risk of contracting the disease itself. Ebola presents with very many vague symptoms to begin with. So it looks a bit like the flu, so fever, pain, aches and pains, headaches, sore throat. And then rather quickly, it tends to evolve to include vomiting, diarrhea, a rash, and in some cases, patients begin to bleed from their mucous membranes, such as their mouth, from their nose, and from their ears. And so we know that it affects a large number of people because it's quite contagious. Yes. But importantly, the case fatality rate is about 50%. And what that means is that 1 in 2 people who contract Ebola die, but that can be as high as 90% in some outbreaks. And so the last outbreak, prior to this one, the case fatality rate rose to upwards of about 90%.
Does that mean, because you mentioned 50 up to 90%, are there different strains of this, or is this the same strain that's going around?
There are different strains of the virus, but this particular strain is known to us. And the mortality or the rate of death varies. And so individuals who are in poor states of health, so if you're malnourished, you have other kinds of conditions, then that makes you at much more risk to succumbing to the infection. But people do survive the infection, and they develop an immunity to it thereafter. But these outbreaks occur in areas of significant socioeconomic poverty, and so that makes it much more difficult for individuals to fight off the infection.
Right. Well, I do remember covering, an Ebola outbreak between 2014 and 2016, which hit the western part of the African continent, claiming many lives. So can you tell us about that bout?
Yeah, there were in that particular outbreak, there were tens of thousands of cases and tens of thousands of deaths. And so, that in that particular outbreak, that's where we know from statistics that, in fact, the average mortality was 50%. But in that particular outbreak, it varied from 25% upwards to 90%. And in this most recent outbreak that we have at the moment, the figures are similar. So there are about 2,800 cases, roughly. Of half of those, there are deaths involved, and there are these new emerging cases in other parts of the area. And so these are some of the reasons why the WHO Emergency Committee has chosen to declare this a PHEIC, and as I said, that involves the state members of the WHO to fulfill a range of legal duties to assist in that outbreak.
Professor, is there a vaccine for Ebola?
Yes, there is a vaccine. It's only very new and it's rather experimental.
Yes.
And it's being used in the areas where there is an outbreak to what we call ring fence the outbreak. So we inoculate individuals who have been exposed and are in these areas. But it's only very new, and the supply is relatively limited compared to the outbreak overall. Importantly, this is the sixth sort of major epidemic that we've had in 30 or 40 years, and it's the first where we've been able to use the vaccine in this kind of way. So we're hoping that is a good measure to help reduce the spread of the disease.
Right. So we talked about vaccines. What about treatment? Once a person comes down with Ebola, is there an effective treatment regimen available?
The short answer is no. So it's a virus, and so like many other viruses, there is often no direct cure. So it's not like a bacteria where we can give an antibiotic. With Ebola virus disease, we treat people symptomatically or supportively. So we provide fluids and measures to reduce fever and to maintain their body systems functioning. Sure. But there's no direct magic cure like an antibiotic. And so prevention is really the key to the outbreak response and to arresting it. And so if we can reduce the spread of the infection, stop others from getting infected, then that's the best and our only real way to stop the transmission.
Right. So speaking of transmission, going back to that, because I want to drive this point clear for anybody who might be traveling in that area or who have reason to go there. So you mentioned blood and bodily fluids. Is that the only way Ebola can be transferred from one person to another?
Yeah, so the virus is transported largely via contact transmission. So if you touch somebody who's infected and you come in contact with their blood and bodily fluids, then that is how it's transmitted. We think that it's also transmitted by large droplets, but that's quite limited. And so what's most important for individuals is that they are aware of where they travel to. And so if anybody travels to an area where Ebola is endemic, that need to take appropriate precautions to limit the transmission that they may come in contact with, these kinds of infections. And so there's a whole range of information that's available on most government websites about these kinds of precautions, but it does require individuals to be conscious of where they are going and what they do in terms of their travel. A lot of the outbreak is sustained by particular local practices. And so, for example, when individuals pass and they die in these areas, there are particular burial practices that are local custom. And so a lot of the work that's been done has been trying to modify those behaviours so that when individuals who do die from Ebola, that others don't interact with the deceased body, so that's where we can stop transmission. And so there's enormous campaigns to ensure that we limit that kind of interaction with the deceased.
Well, what has a global response to Ebola been like this time around? Are groups, aside from the WHO, getting together? Is there some sort of response or assistance that's being offered?
Yeah, there's a whole range of international agencies that work collaboratively through the World Health Organization, and in particular the Global Outbreak and Response Network. And so what's different about this outbreak compared to the last one is that in this instance, the Emergency Committee chose to declare this PHEIC now, which enables resources to occur. There was a fair bit of criticism with the last outbreak that was declared far too late. And so this kind of declaration is really very important because it provides statutory authority for states to act in a way that provides resources and funding. And so it brings to bear legally binding requirements under the international health regulations. And that's very important because it relates to, among other things, trade and travel. And so, when we start to restrict trade and travel on the grounds of the spread of a disease, that has major consequences for societies around the world. And so these kinds of declarations enable all the parties to consider the facts and to make decisions that are rational and best informed.
Right. Professor, for a final question, I mean, here in Korea, we've been met with other types of outbreaks like SARS or MERS.
SARS and MERS,
yes.
That's right.
So is there the possibility of Ebola spreading beyond right now the DRC or Uganda or those particular regions on the continent of Africa? Beyond that, do you think there is a possibility?
Yes, there is a possibility, and that's all to do with travel. And so the main factor here is travel. So in the healthcare system, what we do is when somebody presents because they're unwell, we take a travel history. And so we can fairly quickly rule somebody in or out as to the risk of having Ebola based on a very solid travel history about where they've traveled to, when, their kinds of activities, together with a range of preliminary medical tests. And so that it's important that individuals are frank with the healthcare workers about where they've travelled to and the things that they have done. And that's how we can sort of marshal the best resources that we have available to respond to this kind of outbreak.
Well, I do want to thank you so much for your time and expertise on this matter. Thank you, Professor.
It's my pleasure. Good morning.
This, once again, was Professor Ramon Shaban, and we talked about the latest Ebola outbreak in the Democratic Republic of Congo.